When I talk to patients with type 2 diabetes about exercise, I put it this way. I tell them if you could do something that could lower your A1C, improve your stress level, improve your sleep, improve your health, and had no side effects, would you do it? And the answer is usually yes. Exercise benefits people with type 2 diabetes in lots of different ways. It helps by putting glucose into the muscle cells, and when there's less glucose in your bloodstream because it's in your muscle cells, that also lowers your insulin levels.
It helps you to reduce the risk of cardiovascular disease. If you have high blood pressure, it helps to lower your blood pressure.
When I found out I had type 2 diabetes, I knew I had to make changes in my lifestyle, in the way I ate. I had to start exercising, and that's important because it helps control blood sugar levels. When I go out for a walk and I come home and I take my blood sugar readings, I see that my numbers are much better, and it's great reinforcement to see that that makes a big difference.
If you've been diagnosed with diabetes and you're beginning an exercise program, you want to be sure that your doctor knows what you're planning to do and can advise you on how to monitor.
People with diabetes have to take a variety of precautions before, during, and after exercise. If someone's taking medicines that drop their blood sugar, like insulin, for example, or sulfonylureas, it's a good idea to have them check their blood sugar before exercise to make sure it's not too high or too low. Maybe during exercise if they're having symptoms of low blood sugar, and sometimes even afterwards. People with neuropathy or diabetic nerve pain, which usually occurs in the feet and toes, should be very careful to wear well-fitting shoes and to check their feet regularly for cuts and bruises and open sores.
Another concern for people with diabetes is intermittent claudication, which is a mouthful to say. What it refers to is the fact that when you're doing an exercise for the lower body, like you're walking or you're on the treadmill, and you feel aching or cramping in your legs.
That is a hallmark sign of peripheral arterial disease, which is very serious and needs to be addressed early on. Peripheral arterial disease occurs when there's blockage in the blood flow to the legs, and that's usually from diabetes.
There are three types of exercise in a well-rounded workout program, and those are cardio, strength training, and stretching.
Aerobic exercise will definitely help blood sugar control, but resistance training along with aerobic exercise does even better.
Exercise doesn't have to mean gym, treadmill, elliptical. It could be just keeping active.
If it's as little as taking 30 minutes out of your day to do 2 15-minute walks or 3 10-minute walks and do a few squats and push-ups at your kitchen counter, why wouldn't you do that?